primary endpoint of the study was progression-free survival, and so this uh, was met with pembrolizumab showing a statistically significant and very clinically meaningful improvement over Brentuximab Vedotin. So the hazard ratio ended up being around 0.65. The median progression-free survival for Pembro was a little over 13 months and was around 8 months for Brentuximab. And so that represents, yeah, I think a clinically meaningful benefit for the patients that got pembrolizumab. It's been an interesting study to think about because the population is actually both broad and focused in a way. So the real standard in this setting for a long time had been Brentuximab Vedotin, and that was based on the pivotal trial that had enrolled patients that had had disease progression only following autologous stem cell transplants. And so clinicians, where possible, had generalized that data to also include patients that had been ineligible for transplant due to age or comorbidity or the presence of refractory disease. And so Brentuximab was well established in that population. What these data show is in the place where Brentuximab had been defined by its pivotal clinical trial, pembrolizumab has more favorable progression-free survival. And similarly, in that population that had not been in the pivotal Brentuximab study, but Brentuximab had become the standard up until now, pembrolizumab also had superiority in those non-transplanted patients as well.